working here. And no, we started this course back in 2023. Initially, I started as free course, but then one of your candidates, they suggested me that because people take it as for granted, so better to charge some. But our charges, I think nowadays, course fee is about 5 lakh. We are taking less than uh, 10% of your course fee, less than 10% of your course fee. So, so that is minimal, as we try to keep it as minimal as we can. Um, Second thing is that we are running online as well as hands-on courses. Our online classes are for knowledge part and the communication skills, but for the skills examination and communication skills, again, we are conducting hands-on courses in Islamabad or Peshawar, Karachi and Lahore, all three big cities. And we are the only team who are conducting these sessions in three big cities for the last 2 years. Almost 700, more than 700 candidates have passed uh, MRCS Part B exam through our courses. Initially, in 2024 and late 2024 as well, we used to take uh, all these charges in installments, but then as being typical Pakistani, some of the candidates all are near to heart. They dodged us, and even after passing the exam, they did not pay the installments. It doesn't bother to me, believe me, but where we are standing being as a nation, that defines us. Anyhow, then my team, they compelled me that to take off this important, uh, I would say, concession to pay the fee, same fee in the installments. So we have stepped back from there. So that is not because of me. That is because of you guys, actually. Not you guys. I mean some of the guys. Um, so that is little bit background. Now coming to towards the exam. That what is this exam about? Why this is important, and how does it help you guys? So first of all, MRCS Part B uh, is a combination of exams of your who are Pakistani guys. It's combination of your uh, Part 1, surgical Part 1 plus your IMM. So this is a combination of both exams. Number one. Second thing is that this is being conducted all over the world, a whole year. From if we start from Middle East to Europe, including Pakistan and other Asian countries like Bangladesh and India. So they are conducting almost all over the world and a whole year, almost every month. Third thing is that why are you conducting this exam? Instead that I am answering this question, you should be asking yourself this question, that what are your goals and why do you want this exam? But what are the advantages of this exam? I can tell you. If you want to work, if you want to work in UK, in Ireland, this exam is almost near to necessity for you to work in surgical department. Nowadays, simple passing the PLAB exam is not working at all. So please, this thing you should communicate to your juniors as well, that passing the PLAB exam is not securing you any job nowadays. Second thing is that if you are passing, you are appearing in exam in Pakistan, and then from, if you compare from PLAB to MRCS, so both parts, part 1, 2, and similarly part A and part B, this exam is almost half as when we compare the expenses from PLAB. So that is why this exam is more, and for the job security it is double, because passing simple PLAB, you are not securing any further jobs here in Ireland and UK. So that is why this exam is important. Again, one very, very important thing which you should hear very carefully, listen very carefully, and also please pass to your other juniors or colleagues or fellows, that those candidates who are who want to stay in Pakistan, this exam might be an addition to your CV, but this will not give you any consultant post for that, number one. Number two, those guys who want to work in Middle East or in Middle East, I mean UAE, all seven, and the Gulf and the Saudi Arabia, this exam is not necessary. It can be an addition to your CV. The consultant who is looking after your CV can be impressed by this one, but this is not necessary, and this is not required for that things, and will not secure you any additional job. So these 2 to 3 things which are important to convey before I commence about the exam procedure and exam course details. So coming back, what are the course? This course means syllabus of MRCS Part B, not my course. So this consists of 2 parts. Number 1 is knowledge part, and number 2 is skills part. In the knowledge part, there are 8 stations, and in the skills part, there are 9 stations total. So there are total of 17 stations. Sometimes in some centers they include pilot stations, means to those stations which are new and they are not included in the mark, okay, in the exam. So knowledge part, there are 3 parts again: anatomy, pathology, and critical care. Anatomy will be 3 stations, pathology will be 2 stations, and 3 stations for critical care. So that will be the distribution of knowledge part. Each station will be having 20 marks. Each station will be having 20 marks. There is so it means there will be 160 marks for the knowledge part and 180 marks for the skills part. Very important, this question, please bear in your mind, pass on to your fellows, and please try not to repeat this question. You have to pass both parts separately. You have to pass both parts separately, part A and part B. Knowledge part and the skills part. So you have to pass. If you are failed in one part, your whole exam is 110% failed. Either you pass by 1 number, or you pass by 20 numbers, or 100 marks. So if you are failed in one, you are failed at a whole. If you are failed at in one part, either the knowledge or the skills, your whole exam is failed, and you have to reappear the whole exam. So this is important, which I have to convey to you. And then they're in the skills part. There are 9 stations and 4 different parts: history, 2 stations; communication skills, 2 stations; examination, 3 station; and procedure skills, again 3 stations. So this is about distribution of the exam. Now, coming towards what are the this is the I will share this file as well in the group. um, this is the distribution of the marks in each station. So you can see here, some there are pilot stations. The pilot stations are which are new stations. You are never marked for those stations. Procedural skills, again there are 8 marks in procedural skills. I think so I will come to this part at the end. First I should tell you guys how to prepare and what is the study material. So there are 17 stations. Then the next question which you people ask is to me that either they are taking separate in the skills part is conducted separately and the knowledge part is conducted separately. Yes, it is conducted. Like whenever you go for the exam, I think there are 20 candidates in the morning and 20 candidates in the evening. So um, obviously, if there are 20 candidates and there are 17 stations, there will be 3 rest stations. Depends upon if someone skips the exam or something like that. So they will keep 1, 2, or maximum 3 um, uh, rest stations. Then your stations in the exam might be mixed. For example, there are total of 70, these are total of 17 stations. So they will make like 9 on one, or maybe 7 or 10 on one side and 10 on other side. So it might be mixed, 1 or 2 stations. But having these stations mixed, for example, in my exam, the 2 of the skills stations, they were included in the exam when I was conducting the in the exam, when appearing the exam. They were in that setting where they were taking the knowledge part. So it doesn't mean that those skill stations will be included in the knowledge part when they are scoring you. No, that is in the skills part. That is not in the knowledge part. So if even they mix some stations because of the settings requirement or the logistic requirements, they are not going to they are not going to mark you in the other part. So you are marked as in the knowledge part separately 8 stations, and in the skills part 9 stations. Sorry. So now coming, what is the study material required? So this question again and again appears in front of me, that what are the study material, which book to be studied. So remember, no, again, please listen carefully. One and final time, please. For the knowledge part, there are 2 books which are recommended most of the time: Sala Notes and Turkey Notes. We have studied those as well. Um, we take guidelines from there. What are the Sala Notes? What are they are most of these notes, they have past questions actually. So Sala Notes are the Turkey Notes, this one. But because sometimes their updated files are not here, so um, when I conduct the course and give the stations and we conduct the lectures and all these things, we cover the whole of the topic, about 30 to 40% in our course. We have extra questions, and those which are important clinically and also the exam point of view. I hope you understand what when I say that these are important regarding the exam. So we cover those things, and we cover because we expect that these might come in the exam, and these are important for you clinically as well in your further exams. So that is why we cover those. Second thing is that Macman Atlas, very important. You must have in your PDF files, and you need to see from there. Sing notes, these are very important notes. Short notes, um, same questions almost. They have maybe 20-30% extra questions from Turkey and Sala notes. And those questions are very important. Number one, extremely important. Number two, those questions, the way of asking those questions is different. Their statement is different. So in that, so question might be same, but in different language, in different terms. So these sing notes. So what I recommend always is that first go through Sala notes or Turkey notes with Macman Atlas. After one or two readings, you must go through sing notes. I always say that you must go through sing notes. So this is important. Here you see at up, not in this file. I will share you guys the other file. There is a channel in Telegram. I have shared each and everything. If I get or any new paper, any new question, I share in the Telegram in that group. I have link for that group. You people must join that, and your people are definitely, if you are in Pakistan, you are using VPN for many things. So for Twitter or something like that. So in Pakistan, Telegram works only through VPN. So use VPN. You can easily download all those things from there. And if you feel that something is missing there, you can text me personally that this thing is not there. So I will share there. Why I'm using Telegram for this thing? Because when the new candidates come in the WhatsApp group, they don't get these files because they are the new ones, newcomers. So the newcomers. So that is why we give in the Telegram, when you will join that, even the new candidates, when they join those, they will they can get those books and those materials. So this is very important to join those that Telegram channel. The link for that Telegram channel, Telegram link, if you go for the any group MRCS, I have 3 groups. Why 3 groups? Because there is a limit for every group. We have almost more than 2,000 candidates in our groups. So that is why I have to make 3 groups. So if you go into the group description at the above, then you will feel their whole of the links, their WhatsApp, YouTube, WhatsApp groups. So whenever you have to see from the, you have to search for that, you go there in the group description, all the links are there. So Sing notes, Turkey notes, Sala notes, Salem notes, my own notes, they are all shared there. So you can follow those. So this is the first thing. Here I have given you the WhatsApp link as well. For skills part, I never recommend going through Turkey notes or Sala notes. I feel personally, I have read those. Those are not sufficient. Rather, I would say at some stage misguiding as well, which can charge you in the exam. So that is why I never prefer those. I never recommend those. Best one are Bazid notes. best ones are Bazid note for history. History, communication skills, examinations, all these three best is Bazid notes. There are some deficiencies in Bazid notes we try to cover in our free as well as in the course. What are those deficiencies? The questions which are asked in the at the end by the examiners, these are definitely deficient in some stations. I would say that all of stations 2 or 3, some questions and answers are not sufficient. So that is why we keep updated when we conduct classes for those. For communication skills as well, Bazid notes, um, doctor notes as well. You can just read doctor notes, but not to go completely from there. Examination skills also from Bazid notes and GK medics, and then comes about the procedure skills. Procedure skills, there are total of 7 or 8 skills, not more than that. Number one, I have marked those in the videos as well. That what are those stations? You don't need to go all those given in the Sala or Turkey notes. So procedure skills, best book to be done is Andrew Miller, word by word. Please, this is the book, Andrew Miller. This book is shared in the Telegram and as well as in the WhatsApps. So Andrew Miller is your first key. There are few stations in the Andrew Miller which are not included for MRCS Part B exam. Those are FNSC, taking blood grouping, cross matching. So these are basic. These are actually for PLAB exams and not for us. So remember, these are not for MRCS. So FNSC is not included. Next one comes duration for preparation. So if you have already booked the exam, that is very good thing. If not, then usually at least 3 to 4 months, I would say, with the duty and considering you're working, all these things, I would say 3 to 4 months are required. Again, it depends upon what are you doing at the some. I have seen some of the candidates, my own aspirants, that they have passed this exam in 6 to 8 weeks. So it can be, but taking a big risk with your 5 months of salary is not a good thing. So I would say that always, always keep in mind for almost 3 to 4 months. Okay, 3 to 4 months means at least 4 to 6 hours a day study. Next thing is that how to study. This is one of the key things to for this exam. How to study for the exam. So this is one of the key. When you are studying for this exam, this is if you are a group of 3 people or maximum 4, not more than 4. I would say not more than 3 even, but maximum 4 people. So not more than 4 people. So if you are a group of 4 people, your productivity will be multiplied by 3 or 4. Why? Because this all exam is Viva based. There is no written, there is nothing like that. So when you are studying, study like you are appearing in the exam. Dr. Amir knows that how we conduct these sessions and all these things. So study like this way. For example, if you are preparing any station, infective endocarditis, and you are preparing yourself at home, and then you have read that, you have memorized that, but you are not able to reproduce in front of the examiner, there is no advantage of that memory. But if you are studying with your partner, and he is asking you the question, and you know that I have to answer this whole station in 9 minutes, and there is a watch in front of you, and you answer those questions in 9 minutes and prepare for that, then you have to, then you will see that how are you preparing and at which level you are. Remember again, every station, either in the knowledge part or in the exam part, is uh, of 9 minutes. 1 minute out of station to read the question, and 9 minutes inside the cubicle for your whole of the viva. In knowledge part and the communication part, um, whole 9 minutes you have to perform, you have to answer the questions and all these things. But in the history, in the procedural skills, and in the examination, there's 6 minutes for your examination, followed by 3 minutes of your. So this is also important related to this one. Guys, keep asking your questions in the chat box. I will answer at the end. I will not disturb your things. So how to prepare? I told you that there are 9 minutes. You should be with your partner, answering the questions, rephrasing your answers, and all these things. Just give me 1 minute. So, this is very important statement. Towards the end, it is you. I have highlighted this one. If you can see here, I have highlighted. Whosoever had turned on your video, please turn it off. Turn off your video. Mr. Jawad Shahid, please turn off your video. Thank you so much. Sorry, guys. So I have written it in bold words. You can see towards the end, it is you who must be master of those particular skills and answer the questions. Remember, again, getting the course, either mine or someone else, is not a guarantee that you will pass the exam. Is not a guarantee. What is the guarantee? Obviously, first of all, it is whenever it is your time and Allah's will, then you will pass the exam definitely. Second, your practice, practice, and practice, and practice not for only skills part, but also practice for your knowledge part as well. Why? Because your knowledge part is also a viva. It is not you are just like going there and answering the questions and written, and you have no time to think about those things. You have these things are your just like your on fingertips. Next thing is that what is the best time to apply for the examination? MRCS Part B, the best time is after passing your MRCS Part A. Why? Because when you have passed your MRCS Part A, about 30 to 40%, I would say 50% of the MRCS Part B is the knowledge part. So when you are having the knowledge part already, you know about anatomy, physiology, pathology, critical things. So this is the best way. You know all those things. So your time duration will be for preparation will be coming down. We will give you the schedule. I will at the end I will come towards this part that how to we will guide you and how we will make you ready for this exam. Uh, Next thing is how to appear in the exam. So what is the, what is the most common question asked to me about how to appear in the exam? No one asked me that how to answer the questions, how to manage my time, how to manage all this. No, what they ask me, what things to take in the exam. Can I wear the full sleeve shirt? Can I wear half sleeve shirt? Can I wear niqab? No one asked me that, and no one bothers. I think so. That how to manage 9 minutes time, because in 9 minutes, literally, if it is the knowledge part, you will be asked about 18, 20, at some, in the not mistaken, 25 questions, right? So no one asked me. Either all of you know this thing and have mastered already this thing, all, or maybe you are not. No one is guiding you regarding this thing. But the question asked is, can I wear niqab? Yes, you can wear. Number two, do I need full sleeve or half sleeve? You need half sleeve. Can I wear? Can you wear OT kit? Yes, you can wear OT kit. I myself went for the exam in OT kit, right? Next question is, what I have to take with me on the exam day? Nothing except your ID card or passport, whatever your identity is, or birth certificate if you want to. Okay, nothing else. So I hope I am clear this time to you, all of you, and please convey this message, this most important message, to everyone who is appearing in the exam. That what to bring in the exam and how to appear in the exam. One thing, okay. Second thing, which is for you guys it is secondary, but for me it is the primary thing. They will provide you everything, but they will provide you are the stethoscope, the a hammer, all the materials you need. There they will provide you. You need not to wear the watch or something like that as well. They will take it from you. So again, you see this, someone can read for me this this line in the bold. Someone, anyone, please, can you please read me this line in the bold? Yes, please.
Yes, the knowledge of all such appearing in the exam is more or less the same. The only difference is with the reflexes.
Excellent. So, yes. So uh, it says that knowledge is same. Your skill, the only difference is in your reflexes. These reflexes, either you are in the knowledge part or in the skills part. The only difference is in the reflexes, not the knowledge. You people have more knowledge than ourselves. Maybe you have more knowledge than the examiner. But the only thing is your nerves and your reflexes. And you know how these reflexes will be sharp. How? How these reflexes will be sharp? I have previous is something, and that is saying practice, practice, and practice. So if you're sitting at home and preparing for the exam, I would say you are wasting your time. Go grab one of your friend and start preparing with those. I remember two of our candidates, they scored 168 marks, 168 marks in the skills part. And those were in the very initial time when I was back home. So 168 out of 180 marks in the knowledge part, and almost 150 or 147, I think so, 147 in the knowledge part. And you know why? Because those were the candidates who in our every session they were presenting. In every session we conducted at that time, they were presenting. They were presenting. They were the main presenters. So whoever taking the course, uh, previously I was little bit, I would say, relaxed towards you guys. Now the all the candidates, we will issue the dates and the topics for every candidate, that this day this candidate will present this topic, and that will come alphabetically. The last date in the in December, we had 70 candidates who appeared in the exam through our course. So this time we will be a little bit strict, because some candidates take it light, and at the end, who is responsible? ZQ. ZQ is the responsible. No, I'm not responsible if you're not appearing. If I'm asking in the session again and again, and anyone has prepared this session, anyone please can present the code, present this topic. I am not responsible to present this topic. Obviously, I have given you all the things. I have given you whole of the course. I have given you the lectures, everything. This is your time to present the topic and see where you are deficient. So if you are not practicing, please don't come in the, don't take my course. If you are not presenting, I'm not being, wallah, I'm not being greedy for this course. I am taking this course because you see, I'm starting this course in mid-December, late December, I would say. The candidates are asking me since November, I think so. But I'm taking time. Why? Because you candidates you guys don't bother to present the cases. If you are not presenting the cases, I am not bothering. I was not bothering. But this time, I will be very, very strict. From the very start day, from tomorrow, I will print the list, share in the group, and you people then will be called every day in the group that you are missing, you are absent. So remember this thing this time. So at the end, this is the practice. If you're not practicing, you are not presenting, this is not going to give you any advantage. So now comes here how to attempt knowledge part. I have written again in bold things. This is the most important part, and we all are preparing ourselves for this day. So you know that reflexes are important in the knowledge part. Why reflexes are important? Because you have only 9 minutes. In 9 minutes, you have to answer how many questions? I told you 18 to 25. Some stations have 18, some stations have 20, some 22, almost 25 questions in the anatomy. So now 9 minutes divided by 18 minimum. You have 20, half a minute for one question. Half minute in, for example, if the examiner asks you question in 10 seconds, then you have only 20 seconds. You think about that one and then to answer. To think about that one to answer. So you are not going to waste your time. So for that, you need reflexes. For reflexes, you need practice. So we are here to make you practice these stations again and again. So there will be 1 minute outside the room for the question. And I have given here the example, small example station. It is a anatomy station. Mr. Harry is a 19-year-old man who went RTA and a right hand injury. So you are provided with the hand anatomy. So you know this is hand station coming with you instead of you, in front of you. So now when you go inside, they will ask you all those questions related to hand anatomy, and you have to answer. And no, here it is one key. If you don't know the answer of one question, for example, don't waste your time if you have to think more than 5 seconds. Remember, if you have to think about that answer more than 5 seconds, don't waste your time. What you have to do is skip. Can you please come it later on? Next question. You have to say next question. I will come to this question later on. So they will complete all the questions. At the end, they will ask you those questions. So what you have done now, maybe if you are stuck in that question, thinking, you wasted 1 minute. The next questions, you know the answers, but time is finished. Bell rang. Your time is finished. He will not ask you question. He will simply mark as cross, 0 marks in front of those questions. That is the most important tip. And remember, no one is giving you this tip. No one is giving you this tip. So this is very important. So skip the question. Go at the end and ask the examiner, can you please come to that question? And most of the time they are very lenient, very good guys, except that if someone is from, I'm sorry to say, from CPSP, sometimes they might be somehow cranky, but most of these guys in the exam, at least, they are very good. So so I have written here, you can skip that question and say simply, can I please come to this question at the end? The examiner won't eat you. Okay. So similarly, you have to attempt all 8 stations. So one thing, so this is in bold again. The candidate, this is anyone can read this for me, please. This is very important statement. Anyone, please. This is the key for whole of the exam. Anyone, please.
The candidate who
The candidate who will miss first minute of the reading the question will suffer inside the room.
Exactly. So let me explain to you. So there is 1 minute outside the room to read the question, and then there are 9 minutes inside the room to answer the questions. So if you have missed that 1 minute, for example, you're taking very light. I give you 2 examples from the candidates, from our candidates. One candidate went in London. He was from Sri Lanka, I think so, for the exam. He went to London for the exam, and there was a station for history taking. There was a that the patient came to you with cough and sputum and has some hemoptysis and all these things. So, and before that he was having leg swelling. Take the history. He went inside and he started the chest examination, thorax examination. After 2 minutes, the examiner stopped him and asked that, have you read the scenario? He said, yes, I have to examine this patient. He asked him, go outside, read the question again. And it was a history station. And he filled that station, definitely. So now you know. Second one, she was the lady who appeared in Egypt. She there was a station outside this, the patient, and post-operative, and you know the story of abdominal examination. So this was a secret station. She went inside, started the abdominal examination straight away, and at the end, because the secret is 9 minutes, she definitely she failed. So that is why this 1 minute is important. So remember this 1 minute, if you are not paying attention to this 1 minute, then you are utterly failing your whole of the station. So this 1 minute is very important. Skills part, again, 1 minute outside, 9 minutes inside for the examination. Skills part, 6 minutes to perform, 3 minutes for question answers. So in the skill, remember, what is the most important thing in the skills part? Communication skills. In every station, more than 60% is your communication skills and 30 to 40% is your other skills, your knowledge and other things. So that is why this communication skills is not separated. So there are two stations separate for the communication skills, for the counseling and for call to consultant. This is another thing. But in the examination, even they are 60% related to communication skills, how you communicate with the patient, and 30 to 40% is related to your other things. We always teach this in our not only courses but otherwise as well. And you know, nowadays in Pakistan there is a big gap in communication skills. You have seen recently 2 to 3 examples even. So this communication skills is the main part they emphasize upon and they score upon. I will come to this. You remember the chart we missed in the start. So you will see there that out of 20 marks, there are almost 10 to 12 marks in every station which are related to your communication skills. Okay. So I have written here, I'll just read it very quickly for you. Read the question carefully outside the station, then revise all the steps in your mind accordingly. This is about your first minute. The station will be essentially same as you will be taught. Hence, just consider it as a rehearsal of your previous practice. History and examination station will be consisted of 6 minutes of history and examination, 0.5 minutes, 30 seconds to summarize the history and examination, and 2.5 minutes to answer your questions. Procedural skills are usually judged along with the knowledge part. So most of the time, sometimes they give 6 minutes, sometimes they give 9 minutes, depends upon what station you have. And in the communication skills consist of 2 parts. Communication with the patient, you will be provided. Now, this is very important again. This was the question someone asked me one day before the examination, that how they will provide me any chart there, any file there. One day before the examination, asking me this question, really it made me furious. So in the communication skills, remember again carefully. Communication skills, there are 2 stations. Number 1, communication with the patient. Number 2, communication with the colleague. There will be one room before the actual station. There will be one room. A question will be pasted outside the room. You have to read that question carefully. Go inside. There will be a whole file of the patient's notes for 9 minutes. Now, please take your notes. For 9 minutes, you have to read that file. They will provide you a paper and a pencil. You have to take the notes from that file, from the patient notes, and on your paper. That paper and pencil you can carry with you to the next station, where you have to communicate either with the patient or with the other colleague. I hope I am clear. Again, in the communication skill, for example, you have communication station. For example, counseling of the anxious mother whose child has some surgery, some sort of surgery, for example, appendix surgery. So now this is the question pasted on one room. you will go inside, 1 minute outside the room, you will go inside for 9 minutes, you will be having file in front of you, take notes from there, every important thing on your paper. After 6 minutes, because they will ring bell every 6 minutes, every 1 minute, then after 6 minutes means 7 minutes and 10 minutes. So after 6 minutes they will ring the bell, don't bother for that. Then after again, when the 10 minutes are completed, they will ring the bell, come out of the station, the next station or the next room, again 1 minute for the question outside, because that is the standard. Go inside, there will be patient or the patient's father or mother whatsoever, and you have to counsel for that. And you can take your notes with you in front of the patient, and you can see over the notes as well. Clear? I hope there is no ambiguity. If ambiguity, you can ask me at the end. You can take notes and can ask me at the end. Similarly, for call to consultant or call to your colleague, we call it as communication with the colleague. Again, 1 minute outside in one room, and 9 minutes outside inside, and then the next room again, 9 minutes, 1 minute outside and 9 minutes inside. Then we will tell you that how to call to consult and all these things, right? So that is how your examination is conducted. I don't think so if I left anything, but if I left anything or you have any questions, you must ask. There is few questions in the group. I will answer those questions. So is there any course outline given by the RCS that is followed? I mean, she is asking about the syllabus outline, not the course outline. She's very cool, Pakistani. Remember one thing, time to time, we remove all those candidates who from the WhatsApp group who don't have their real name on their WhatsApp profile. There are some rules where we don't compromise. And the reason behind that is, some girls, it is for your safety, not my safety. No one can intrigue me, and no one can keep me busy with these things. Some girls, they were really embarrassed by some guys. So we have to then remove them. And the reason behind that was because they were not having their names on their WhatsApp profile. So that is why this is very strict policy from our side. So this school Pakistani, even if you next time change your name, please. Is there any course outline given by RCS? I think you are asking about syllabus outline. You can search on the RCS. They have some just brief outlines, so you can. Telegram link, yes, this is already I told you. Please, can you post the link to the what is here so we can copy it? Please, can you post the link to WhatsApp here? So to WhatsApp here. Okay. Okay, Dr. William. Yes. Yes, I can. Just a second. Give me 1 second. So this is the group, for example. Just a second. You see this one. So this is the description. You see this description. You see this description. So in this group, there are all these things. Okay. So I'm going to paste it here. You can join it. Okay. What do you suggest someone is preparing home alone? Mr. Adam, very good question. So you can take someone on call and present to that. So that is what we did back in 2020. We used to call them and present them and all these things. And station take up to double the time. So it doesn't matter. That is their problem, not our problem. They take whole day or the double time. From where we get bazaar notes. There are no bazaar notes. These are Bazid notes, not bazaar notes. So Bazid notes. So there are Bazid notes I have in the Telegram channel. I have sent to you. Do we need to read both books, Sala notes and Turkey notes? I would say that go through Sala notes. And second, there are some deficiencies and some mistakes in Sala notes. I keep them updated time to time in my group and also in my course. So you can see over those things and ask in the group. I would prefer you can go through both, but more or less they're same. It's okay, Dr. Hira, thank you so much. Thank you. No question, one by one. Any question, please? One question I know you will ask me is this this session recorded? Yes, this is recorded and I will share in on YouTube and will share with you. Yes. Next question, please. 3 to 4 months. Yes, you know. Yes, course details. Fee will be shared as well. Now coming towards the course details. So this is the course. You can see fee. I have told you it is 10% of the your exam fee. Your exam fee. Yeah, your exam fee. 10% of your exam fee. So fee is not maximum. We kept it minimal. But here is the course details. So this is our schedule. This is our schedule. You see, we are starting from tomorrow. Head and neck and infective endocarditis, malignant hypothermia. So these are our classes will be on Saturday, Sunday, and Monday. 3 days. Friday is the spare day. Whenever we miss some class, we taken on Friday. Sometime Tuesday. This is the schedule. You see, we're starting from 21st of this month and all of the anatomy and then pathology and then communications. After that, after fixing with the anatomy, we will start with the critical care. So here is the critical care, all the critical care plus pathology and all these things and communication skills. And you see all these things. And then after this is finished, this will be finished by 15th of February. So then we will revise it 1 or 2 times. 1 or 2 times we will revise it. And once it is revision is done, then we have along with that hands-on courses. Hands-on courses will start from January, mid-January before Ramadan. We will conclude with that. So we have 3 hands-on courses. I told you already. There is from the previous. I will share you result from our previous courses. We have more than 97% results with those. More than 97% candidates. they have passed the exam with communication skills and all these things. More than 97. I will share you results because I don't have those that audit with me. We audited actually that thing. So this is our course. I have written few things which are very important for you people who are taking the course. This is a course for those candidates who cannot afford those costly 300 plus GBP fee for the courses. If you are rich enough, you don't need to take this course. Please spare it for someone who is not rich enough. So this is the first and very important thing. So this is very important. Fee is not acceptable in installments from now. This is from last year. Some of the Pakistani candidates, I mentioned it, I am a Pakistani, I'm proud Pakistani. I even named my group as MRCS Pakistan, not by my name, but I'm sorry, some of the Pakistani candidates have not paid even after passing the exam. It became ridiculous for our team to ask again and again for installments. I am 18 plus, I suppose. You are 18 plus as well. So I don't expect these things. Foreigners can pay in installments. Yes, due to our very good experience with them, they can pay. Off days can be shuffled. We have mentioned this. This very important thing in green is this subscription is until you pass the exam. So either you take 1 year or 2 years. Until you pass the exam, we will be teaching you. This no one on the globe is offering you this offer. This subscription is until you pass the exam. You need not to pay again if you could not get through, unfortunately, for anything. So you need not to pay again. At the end, there is knowing the answer only is not enough. You can never get through the exam until you have practiced enough. So we practice in this. So you will be provided what you will do. You will be provided all the recorded lectures. Number one, how we'll run this course. This is very important. So you will be provided with all the recorded lectures. For example, tomorrow we have anatomy, for example. So we will add you in the classroom. In the classroom, you will be having a full list of all those. See, I forgot to tell you about my course. That is how serious I am to sell my course. I'm just to guide you, but I forgot completely that someone reminded me that you were talking about your course. So you will be provided with all those 300 plus lectures on every topic. There are lectures. Some topic even they have more than one lectures. So you all the communication skills, examination videos, all the skills part, knowledge parts, everything. You have the lectures, and you have the important stuff as well. So you have to watch those. This is important now. Very important, guys. Before you appear in the class, you have to watch the video and you have to prepare your things, and then come to the class and present your topic. So this is important. So for example, if I show you my classroom, just a second. Just 1 second, give me 1 second. So here I have my classroom. So here is MRCS OSCE hands-on. This is for all those candidates who just take hands-on and don't appear in the um, knowledge part online course, and then they fail the knowledge part and come away. This is for those candidates only. And this is MRCS October to December. If you see here classwork, this is the classwork. You see, don't hack my account if someone is. So this is, you see here, history skills, all the stations about the history skills. You see here, view more. So I have all those history lectures recorded. Yes. And then there are examination videos, all the examination videos, then surgical skills. Then this is about the schedule. This was old schedule. Call to consultant, then counseling stations, all the then there are few videos about hands-on station Karachi and Lahore. Then there are anatomy. These are all anatomy lectures. Then critical care, and at the end there is online sessions. We take every class every Friday, Saturday, Saturday, Sunday, Monday, and then there are pathologies. So this is how you can see there are more than 300 plus lectures. But thing is that taking the course again very clear. Taking the course is not the guarantee. When until you prepare for the course, you prepare for the session, come in the session and present yourself, there is no success. So this is about our course. So I have written here, you will be for a presentation, and during the weekend, all the online sessions will be exactly according to. So we always, all the online and even the exam sessions, hands-on sessions, we according to the Royal College's exam. One very important thing, sorry, I skipped. All the colleges are this exam, we call it as intercollegiate exam. Intercollegiate exam. The meaning of intercollegiate exam is that all of these colleges, they have one committee. They sit there and they decide that what are different stations. It is Royal College of England, it is London, Glasgow, it is Edinburgh, or the RCSI. Okay, all have same stations, same curriculum, and same team to conduct the exam. Pakistani examiners who have FRCS, they come in the RCSI exam, they come in the RCS Edinburgh, similarly all over the world. Remember, so these are same stations. There is no difference. The difference where lies when, for example, Pakistani candidate comes to UK, for example, for the exam, he gets a difficult competition because he has to compete then with the UK candidates. So here lies the difference. Anyhow, our recently are 3 to 4 candidates who presented in the UK center. All of them passed. We had 100% results from there. So that was very good experience. Although it was second or third time, but it was very good experience that they passed the exam there as well. So there is no difference. Second thing is that when you pass from any college part A, for example, I passed from RCS England part A, but for the part B, I appeared in RCS Edinburgh. You will get the lessons from where you have passed the second part B, but you can apply for GMC after passing from any college, either it is RCSI or RCS England or any RCS. So you can apply with that. So this is very important information I have to relay to you guys. how to join the course. I will share this file to the group. Here is the link as well as the group. The fee, I have to ask my team what is their fee. I don't know what is their fee. They manage this thing all. Mr. Norez, he manages the finance. So he knows what is the fee and he will tell me what is the fee for the course, and then I will tell you what is the fee. So that is about my course. Screen is not sharing. Okay. Screen is being shared from me. Anyhow, I'm finished. Class timing, very good question. Class timing is usually, unfortunately, it on Saturday and Sunday it will be 8 or 9 p.m. But on Monday it will be unfortunately 11 p.m. because I am on duty on Monday. We get free here at 5 p.m. Usually I take 1 hour to come at home and take my lunch and dinner, and then yes, 11 p.m. Pakistan time on Monday. Saturday, Sunday, it will be earlier, obviously, because I'm free on Saturday and Sunday. Any other question? No question? इसके साथ ही मुझे इजाजत दीजिए. अल्लाह हाफिज. Will you have practice session in Peshawar? Yes, we have practice session in Peshawar, inshallah. I will send you guys the dates and everything for coming hands-on sessions. Thank you so much. Dr. Tahir, this question is difficult for me. My team members, they are very annoyed by this thing, but I am very lenient. So I would say that if you have not applied for the book test, there will be minimal advantage to you, not big advantage. If I go with the previous audits, the candidates don't take it serious. So I would say that yes, you can take, but better to take the at the end. I am lenient, but Mr. Norez, he is very strict in this matter. He says that no candidate until they have booked the exam. So hands-on session included in this course. This I don't know what's the purpose. You are asking about the course fee, or yes, in course, yes, it is included. Fee structure, I told you, I will ask Mr. Norez. He is managing finance. Although I am the director of the course, but he is the finance manager. So I will ask him what is the fee structure and whatever decided by him and the team, because I don't manage the finances. So I will ask them, and whatever there will be, it will be in front of you in few minutes, maybe 1 or 2 hours if he is alive. Okay, guys, thank you so much. Thank you. Any question that regarding of today? See, I asked you, this question will come in front of me. Yes, this is recorded and I will send you the recording. Thank you so much. Thank you.
Hello.